We'll look at another type of dislocation of the shoulder, and this one is a dislocation that could happen, and the head of the humerus is not coming to the front, but it's going to the back. The one that is coming to the front is the one that is like the most common type. You understand? But for this one, the dislocation is occurring, and the head of the humerus is going to the back. Okay, so it's actually a rare, but it's actually a serious injury. This is where the humerus head is displaced backward. So usually they miss it on initial assessment, okay, especially after the seizure or trauma. But when you do the imaging, most at times, this is where you now get to know. Like they just feel like, okay, it's a normal shoulder fracture. But it's after you do the imaging that you now be able to know the type. So this is how the imaging of posterior dislocation will look like. Okay, posterior dislocation. So most of the times, the humeral head is out of the glenoid fossa. Okay, so what is it? Okay, that's what we got. So features, mechanism of injury usually due to maybe seizures, electrocution, like Nepal, like electricity shocked you, or trauma. You fell on an outstretched hand when your hand was internally rotated. So when you hit it, dislocate backward. So clinical presentation is the patient arm is held in adduction and internal rotation, and there's severe limitation of external rotation. If you try to take the arm away, there will be a lot of resistance. Then pain and swelling around the shoulder. Okay. Sometimes they misdiagnose it as frozen shoulder. Okay. So diagnosis is, if I want to confirm this, of course I'll do X-rays. You know. So anterior posterior view is there, and you look for the light bulb sign. Okay. So you could see this place is looking like a bulb. So that's what we call the light bulb sign. Then axillary and scapular wide views are essential to confirm the posterior displacement. Then they can also do CT scan and also MRI if fractures or soft tissue injuries is suspected. Okay, so this is what we have for the posterior dislocation. The head of the humerus is moving backward. Okay, head of the humerus is moving backward. So management include, if the fracture is simple, just close reduction. Reduction is I'm trying to bring back this bone right back into its place. So when I reduce, I'll now tie your hand. Okay, use a sling, tie it to the neck so that it will be in one place till you heal. So if it is complex, they can do open reduction where they have to do surgery and tear you up so that they can make sure that the arm is repositioned right. Then rehabilitation where they can do all those early physiotherapy to restore the range of motion, strengthening of the rotator cuff and scapular stabilizers. Okay, and all of that. Okay. So of course you'll not be using that part of the body like you used to. Okay, because you want to allow it to heal for the time being.